Hi Mad, welcome back to my clinic.
Thank you for having me.
What brings you in today? I see we have a 1 p.m. appointment.
Well, I'm not feeling that well.
Not feeling well?
For the last few weeks.
Okay.
I've been having some ticklish sensation in my throat.
Ticklish sensations in your throat.
And
right here?
Well, it's really on the inside, I would say.
On the inside, got it, okay.
And I also had like an itchy cough and watery eyes.
Alright, watery eyes, itchy cough.
I have no clue of what is happening and I'm really here for an answer.
I will be more than happy to take care of you today and perform an allergy test, a head, ears, eyes, nose and throat examination to make sure that there's nothing systemic that's going on with you. Most likely it's only allergies based on the symptoms that you're describing. Spring is here and we're getting a lot of pollen in the air. So I believe that may be the cause, but we're gonna have to go ahead and see.
Sounds good. Thank you so much.
Just going to put on my gloves before I begin the examination. And are you in any pain right now, Mad?
No, just a little bit of discomfort. I still feel that itchiness and tickly sensation in my throat.
Okay. And have you had any blurred vision or double vision in the last couple of weeks?
No.
Any flu-like symptoms?
No, no fever.
No fever, no flu-like symptoms. Any ringing in your ears?
No.
Any difficulty breathing?
No.
Alright, so let me go ahead and listen to your heart and lungs first and take your vital signs. Just relax for me. This is going to feel just a little bit cold. I do apologize for that. I'm just listening to your heart for any murmurs. I'm able to hear S1 and S2, not hearing S3 and S4, which is very good. Going to listen with the bell side. Your heart sounds perfectly healthy, not noting any murmurs. Okay, let's go ahead and listen to your lungs as well. Take a deep breath in for me. And out. In. And out. In. And exhale for me. And one last time. Hold it. 3, 2, 1, 0. Release. Excellent. I'm not noting anything abnormal with your lungs. I'd like to take your temperature next, just to make sure that you don't have any flu-like symptoms, any fever. .5, that's a perfect temperature. No fever is good. Let's check your levels of oxygenation. May I please have your index finger? We'll place this right here, turn it on, and just relax your palm in mine. I'm reading 98% oxygenation, about 88 beats per minute. So you are relaxed. Your vital signs are all normal. I'm going to go ahead and palpate your head next. Is that okay?
Yes.
Okay. Just relax for me. Just want to make sure there are no lumps or bumps. Checking head symmetry. No lumps or bumps. Any pain in the back of your head?
No.
Cervical spine is not tender to the touch. Just going to feel your neck. jawline. Lymph nodes are not enlarged. Feeling above your clavicles. Not noting any lymph node enlargement. Go ahead and look at me. Puff out your cheeks for me. Keep them puffed. Don't let me press down on them. Very good. Now raise your eyebrows as far up as they go. Going to attempt to press down on them. Don't let me do that. Excellent. Close your eyes really tight for me. Shut them. And I'm going to attempt to open them. Don't let me do that. Very good. I'm going to try to move your head left and right. Don't let me do that. Wow, strong muscles. Now I'm going to attempt to push your head back. Don't let me do that. And bring it forward. Don't let me do that. Excellent. I'm going to check your eyes next. Have you noticed any blurred vision, double vision? No. And a little bit of watery eyes. Any redness or swelling?
A little bit of redness.
Okay.
But it comes and goes.
Comes and goes. So right now, just by looking at you, I'm not able to see any redness, but can you please look up for me? Let me make sure I take a look at the base of your eye. And over on this side. Excellent. And look down for me. No redness. Excellent. Not noting anything abnormal. Can you please look at the tip of my nose? I'm going to check your pupil response. Can I just flash my light into your eye a couple of times? I do apologize. Right here. Pupils are round and reactive to light and across. Excellent. One more test. And over this one. Excellent. I'm also going to check for the size of your pupil. About 3.5, which is normal. Excellent. So I'm not noting anything abnormal with your eyes. As of right now, I do want to take a look at your cornea and ocular nerve. This is an ophthalmoscope, and I'm going to shine it in your eye one more time. Can you please look in the distance for me? I do apologize. It's going to be just a tiny bit ticklish to pull down on your eyelid. And I'm going to attempt to visualize your cornea. Can you please look up for me? And down, left and right. Optic disc looks intact. No cornea scratches, no tears. That's very good. Okay, I'm going to do the same test over on this eye. Okay, cornea looks intact, no popped blood vessels. Can you please look up for me? And down, left and right. Optic nerve looks intact as well. Nothing concerning physiologically with your eyes. Okay. Alright, Matt, so what I'm going to do next is check the sensations in your face and make sure that the cranial nerves that control the muscles of your face work as expected. Can you please close your eyes for me and tell me where I'm touching you? I will be touching you with a very thin device.
Left cheek, right cheek, chin, forehead, nose, chest.
Excellent. May I please have your hand? I'm going to touch you with two different textures. This is what I call sharp, and this is what I call dull. Close your eyes and tell me, which one do you feel?
Sharp, dull, sharp, dull, sharp, 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 dull.
Excellent. Next up, I'm going to focus on your ears. I'm just going to palpate them and make sure that there's no pain or anything external going on with them. Do you feel any pain?
No.
Can you please look over to your right side? I'm going to just inspect the auricle of the ear on the outside and the entrance to the ear canal, not noting any redness or swelling, no discharge. I'm going to go ahead and look inside with my otoscope. A little bit of wax buildup. Normal tympanic membrane, pearly gray. No signs of any inflammation. Okay, let me take a look at this one as well. Normal ear auricle. I'm going to go ahead and inspect the inside of your ear canal. Okay, early gray tympanic membrane. No cerebrospinal fluid leaking in the back of your inner ear. And just a little bit of wax buildup, no signs of any inflammation. Excellent. So far so good, Matt. I'm not able to notice anything abnormal. I'm going to test your hearing next. Can you please close your eyes and tell me which ear do you hear a sound with, left or right? Right. Left. Right. And can you please tell me when you stop hearing the sound? Excellent. Your hearing is perfect. I'm gonna focus on your nose and your throat.
Okay.
Have you noticed any loss of smell recently?
No.
Alright, can you please tell me what it smells like?
Pine nuts.
Pine nuts, excellent. Can you please cover one ear and tell me what it smells like?
Mint.
Mint, excellent. And can you please cover the other ear? And tell me what it smells like.
Coffee.
Excellent. So intact sense of smell. I would like to visualize the inside of your nose as well. Can you please look up for me? No obstructions noted. Normal color. No abnormalities. And over on this side as well. Continue looking up for me. No signs of a deviated septum. No discharge and no inflammation. Excellent. I like to take a look inside your mouth as well, in the back of your throat, to make sure that there's no inflammation or infection or anything going on.
Okay.
Okay, can you please open your mouth for me and say ah?
Ah.
Nothing abnormal noted. Do you remember when the ticklish sensation in your throat began?
3 weeks ago.
3 weeks ago. Have you made any changes to your diet that could explain it?
No, I eat the same.
Let's test your sense of taste. I'm going to drip one essence on the tip of your tongue. Can you please identify what this is?
It tastes like chocolate.
Very good. And one other essence, a little bit different than chocolate.
That's vanilla.
Vanilla, perfect. Right, Matt, so everything checks out. Your head, your ears, eyes, nose, and throat are okay. I'm not able to see anything that could explain the symptoms. So I'm still considering the allergies, which is why I would like us to take an allergy test next. Okay. We have here about 10 different allergens. A couple of allergens for insects, food, different chemicals that are usually found in objects around the house, dust, pollen. So I'm going to test a very wide spectrum of allergens, and hopefully we're going to get down to the bottom of what's causing this for you.
Sounds good.
I could do the allergy test over on your arm or your back. Do you have a preference?
I prefer the arm today.
All right, let's do that.
Okay.
All right, Matt, I'm going to change my gloves next. And like I mentioned, we have about 10 different allergens. So I'll be able to cover a very wide spectrum. And hopefully get to some facts about what's bothering you. May I please have your hand? Okay, I'm going to sanitize your skin first. And prepare the area where I will apply the allergens to. Going to gently exfoliate it. Making sure that there are no marks or lesions. Okay, so this looks like a good clean area to apply my solutions onto. I'm going to mark the application area 3.5. Point five, 2.5, 2.5. 1.1 and 1.1. Okay, this is going to be the control and the neutral. I'm going to start with the first allergen, which is an allergen to insects. A couple of drops. We're going to soak this into the skin really thoroughly and allow the reaction to happen over the course of about 5 to 10 minutes. Okay, next allergen is an allergen for pollen, which is very common, especially in the area where we live. This allergen is for seashells. We'll go into number 4. And all of these substances are in very controlled quantities, so they will be harmless to you. And I'm also going in with an allergen for grass. This one is an allergen for hair from various animals such as dogs and cats. Do you have any pets, Mad?
I do.
You do? Have you noticed anything?
I mean, I've had my dog for 3 years.
So 3 years is a long time. Most likely this will not be reactive, but we will have to find out. Alright, soaking this in really well into the skin. I'm happy that I exfoliated your skin first. Okay, this allergen is to latex. Have you worn any latex pad?
Yes, I did.
And you've not noticed anything abnormal?
Well, I did buy some latex gloves recently.
Okay. Any itchiness in your hands because of them?
No.
Okay. This allergen is to peanut. And finally, this one last allergen is to coconut, which is an ingredient that is very often found in cosmetics products, creams, shampoos. So it's a very, very common ingredient. Let's just soak this really well into the skin. Make sure that we expose your body to a very innocuous quantity of these allergens. Okay, but let's leave this for a couple of minutes and see if we get any reaction.
Okay.
Do you feel any tingling sensations in your arm?
No.
Okay, so I'm able to see a reaction only on number 1, which is the insect allergen. That's very interesting. I don't usually get a lot of patients that are allergic to insects. Number 2 to 8 are negative. Number 1 is definitely positive by looking at your skin. Have you ever been stung by bees, hornets, wasps, spiders?
Not that I know of.
Okay, so that's good definitely do try to avoid that if you can.
Yes.
Okay, I'm going to go ahead and clean up the area and we can discuss the results further.
Thank you.
Alright, Matt, thank you so much for allowing me to do this allergy exam on you today.
Thank you for having me.
The good news is that there is nothing physically wrong with your head, ears, eyes, nose, and throat. We did get one positive allergy reaction to insect. Now I can't really tell which insect you're allergic to, so we would need a more in-depth examination, which I do recommend.
Mm-hmm.
You really want to know in these sort of situations exactly what to stay away from. So I would recommend that you take another test.
Okay.
Other than that, not much that we can do. Try to stay away from insects, and so nice seeing you today.
Nice to see you too. Thank you so much for doing this exam on me.
Most welcome, and I'll see you back maybe in a month when we can schedule the follow-up.
Thank you. Okay.